would like to now turn the presentation over to Dr. Jonathan Mermin from CDC, National Center of HIV, AIDS, Viral Hepatitis, STD, and TB Prevention. If we could have the next slide, please. Thank you. Dr. Mermin?
Great. Well, thank you, Karina and Rich, for organizing the webinar and for some great slides and points. Next slide, please. I wanted to highlight a little bit about the epidemiology of what's going on in the United States with regard to opioids, viral hepatitis, and HIV, and then talk about some action steps. Next slide, please. So first, we are dealing with a massive increase in overdose deaths from what is a growing opioid epidemic. Over 500,000 people died from overdoses over the past 15 years, and over 60,000 of those occurred last year alone. No state in the Union is unaffected by fatal overdoses. In fact, although there are some states like West Virginia, New Hampshire, Kentucky, Ohio, Pennsylvania, New Mexico, that have been most profoundly affected, every state has seen an increase in overdose deaths since 2010, and often these have been profound. We also can see here that deaths due to prescription opioids in purple have leveled off since 2011, to some extent because of a response from the nation to try to reduce the overprescribing and reduce access to inappropriate use of prescription opioids. But we've had a dramatic increase in deaths from heroin and synthetic opioids, such as fentanyl, which now make up over 50% of all the opioid deaths. Next slide, please. And what we can see on this map when it shows up, yes, is that the rate of overdose deaths is actually correlated with the amount of opioids prescribed by clinicians in a state, and that varies considerably. So some of the areas in this map, prescription rates of opioids are over 1 prescription per person per year. That would be in the maroon areas, and a rate that's more than twice as frequent as in the yellow states. So harmful opioid use and drug overdoses are associated with how easy it is to get prescription opioids, but also increasingly they are associated with non-prescription opioid use. Next slide, please. Concomitant with this, we've seen increases in viral hepatitis as well. And I just wanted to highlight that over 22,000 Americans die of either hepatitis C or hepatitis B each year. And there's been a doubling of the number of pregnant women with hepatitis C. This increase in viral hepatitis is mostly due to injection drug use associated with opioids and other illicit drugs. With regard to transmission to infants, there's been a long history of knowledge about hepatitis B potentially being transmitted to infants, and there is guidelines for birth dose vaccination of hepatitis B, and then also for providing other interventions that can prevent transmission to infants when the mother's known to have hepatitis B infection. And those have been highly effective, although not reaching everyone who needs it. But hepatitis C raises quandaries both clinically and scientifically because there are, at the current time, no treatments for hepatitis C that have been approved for pregnancy or for infants or prophylaxis. So, and about 5 to 10% of infants born to mothers with hepatitis C will develop the infection. So we do have the ability to prevent these infections, and in the case of both to treat them, and in hepatitis C's case to cure them, and in hepatitis B's case to prevent them with a vaccine, but there's a lot more to do. Next slide, please. So with regard to HIV infections in the U.S., we've had remarkable success in reducing HIV incidence among people who inject drugs over the past 2 decades. And in fact, you can see here, using diagnoses of HIV as the marker, about 6,400 people acquired their HIV presumptively through injection drug use in 2006, and that has decreased steadily until 2015 when we had the first increase in a long time, and that increase is 4%, but it followed a 63% decline over the 10 years prior to that, and that's being threatened because of increasing drug injection that is being done by sharing needles or syringes with other people. Next slide, please. I also just wanted to highlight that that there are often severe infectious disease consequences to opioid use, particularly injection drug use. So between 2002 and 2012, the hospitalizations due to opioid use increased, but so did hospitalizations due to endocarditis, septic arthritis, which is infection of your joints, epidural abscesses, which are abscesses in kind of the spinal column, and then bone infections. And all of those are associated with unsterile injection. And then there are also other costly health consequences to the opioid epidemic that are not infectious disease related, like neonatal abstinence syndrome, which increased 300% from 1999 to 2013, and that alone costs over $1.5 billion per year to the healthcare system. Next slide. So what can we do? And there's really a lot of, within the overarching strategic framework that we can do. One is we can prevent the harmful use of opioids. And there's a lot of actions, whether establishing and taking part in the prescription drug monitoring programs in one state, to working with programs for youth that prevent use of opioids, to helping people who are in chronic pain to reduce their use of opioids so that they don't end up becoming addicted. The second issue is prevention of HIV and viral hepatitis. There's a lot of ways that we can do that, but particularly for people who inject drugs, ensuring that there's access to sterile injection equipment and that people know that they are at risk of these infectious disease consequences and that they can prevent it through certain measures can be very helpful. Third is treatment of substance use disorder. There's several highly effective medications that help people not use or inject drugs, including methadone, buprenorphine, and now Probufen, which is a long-acting buprenorphine derivative that is an implant that lasts for 6 months. All of those increase the chance that people will not use drugs, and as Rich had mentioned, they can be synergistic with other prevention programs. So if one participates in syringe service programs, you are 3.5 times as likely to actually stop using drugs as well. The other issues, those substance use programs can actually screen people for HIV and hepatitis and ensure that people are treated appropriately if they have those infections. And we can also vaccinate people for at least hepatitis B and other vaccine-related infections that occur among people who use drugs. Next slide, please. So CDC's response, this slide was originally kind of derived to talk about some of the 5 pillars that are focuses for CDC to prevent opioid overdoses and opioid-related harms. They also can relate to the infectious disease consequences of opioid use. And really, one understands the importance of building the state, local, and tribal capacity, both to respond quickly if there are outbreaks of infection, but also to work in all the different areas that help us prevent or treat these either opioid use or the infectious diseases associated with it. We also can support providers, health systems, and payers through either our guidelines for prescribing opioids for chronic pain, or health systems can implement coordinated care plans that closely monitor and integrate care for patients on chronic opioid therapy. And then pharmacy benefit plan managers can foster kind of the implementation of guidelines through improvements of coverage. With regard to public safety. It's critical for a variety of interventions that there's a strong engagement with public health, clinical care, and law enforcement. And this is important not just for what law enforcement is doing for preventing access to illicit drugs and DEA's high-intensity drug trafficking areas, but also to use surveillance to see where there's the greatest need for interventions and educate the public safety community about opioid use disorder being a chronic disease and the importance of preventing infection with HIV and hepatitis and other diseases from injection. We can empower consumers to make safe choices through a treatment awareness campaign, which uses real-life testimonials that we're using right now for people who've really kind of suffered through this and have the ability of a firsthand experience to share that can really move people to make changes in their lives. And then we also conduct surveillance and research to make sure we're doing a better job. This is an unprecedented public health threat, both from the overdose side and the increasing hepatitis and HIV cases. And we need to do research to be able to make sure that we're doing a good job when we have programs, and then to develop new technologies that will help us do a better job, including and ensuring that we have adequate surveillance systems. Next slide, please. So I just wanted to highlight this, that one issue is, where could this be going on? Where could we be having HIV and hepatitis C and B being transmitted among people who inject drugs? We thought about conducting a mathematical model that would help us learn where there might be counties that are a particular risk. At the same time, Congress also asked health departments to submit information to CDC if they thought that they were at risk for or were currently experiencing these outbreaks, to allow them to use federal funds for syringe service programs. And when we did that, we kind of have developed this map. This is a current map that shows that 44 states and Puerto Rico have areas that are either at risk for or currently experiencing these increases in infections or outbreaks. There are probably places in every single state where this is a concern, and it involves the local community and the local health departments and the state health departments to look at the information available to then be able to react quickly and to respond effectively and comprehensively to make the differences that we need in preventing new infections. We also, I have a note here that we soon will be issuing a guide on managing HIV and hepatitis C outbreaks among people who inject drugs, so that state and local health departments can respond most effectively when they see that the need is there. Next slide, please. And then lastly, it's important to leverage existing services. Community health centers and HIV and STD programs and clinical services exist in all the states, and those programs can screen and refer people to substance use treatment, and they also can test and treat for viral hepatitis and HIV. And then viral hepatitis programs, which we support in 46 states, can do enhanced surveillance in the states that at least have some resources, either federally or from the states, to actually look for where we're seeing acute hepatitis C and sometimes hepatitis B cases that can actually say this is where we need to respond most effectively because it's an indicator of the need for rapid community action. Next slide, please. So we think we need to, the opioid epidemic is increasing infectious diseases. The situation is not inevitable, but we really need to think big and act fast. And comprehensive community-wide programs can prevent these infections, they can reduce drug use, and they can save lives and ultimately save money as well. Thank you. Next slide.
Thank you, Dr. Mermin. I just want to thank you so much for all of your work on these important issues. Your leadership there at Centers for Disease Control and Prevention is really critical as we all work together to respond. So thank you so much.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.